Hello and welcome to our video about cervical screening, which we have made to help you feel more informed about cervical screening and the procedure involved. All women in the UK are invited and encouraged to take part in the cervical screening programme. All women between the ages of 25 and 64 will be invited. If you are between the ages of 25 and 49, you will be invited every 3 years, and between the ages of 50 and 64, this is changed slightly to every 5 years. We encourage you to update your details with your GP so that they are able to invite you at the correct time. This video is to help you to understand, as I said, the method involved. Please contact your GP for further details.
When you receive the invite for your test, you should ring the surgery and make an appointment. The test is undertaken by one of the practice nurses or sometimes one of the doctors. You will be asked to undress from the waist down and lie on your back, with your ankles together so that your knees fall apart. Firstly, your doctor or nurse will gently insert a new clean speculum into your vagina. A speculum is a plastic cylinder with a round end, which can open up, allowing your doctor or nurse to see your cervix. Sometimes this can be a little bit uncomfortable, but it shouldn't be painful. Once the speculum is inside your vagina, the nurse will see your cervix and take a sample with a small, soft brush. And that's it. The smear test usually takes around 5 minutes. Most women find that the thought of the smear test is far worse than the reality, and it is nothing to be frightened of.
What does the smear test look for? The smear test looks for a virus called human papillomavirus, or HPV. Certain types of HPV are linked to cancer, or what's called high-risk HPV. So that's what the smear test checks for.
And how do I get HPV?
HPV is passed on through sexual contact, which can cause people to feel worried or embarrassed about it, but it's nothing at all to be ashamed of. 8 out of 10 of us at some point in a lifetime will come into contact or have HPV, and we just clear it ourselves without it ever causing any issues.
Okay, and so what do my results mean?
Well, if no HPV is found on the sample, then you'll just have another smear test in 3 years' time. If they do find HPV on your sample, they'll have a look at the cells. If there are no abnormal cells found, then you'll have a smear test in a year's time to check the HPV is cleared. If they do find abnormal cells, then you'll be asked to go for a further test called colposcopy, which a doctor or nurse at the hospital will do, and they'll have a closer look at your cervix in more detail.
When will I get my results back?
It normally takes about 6 weeks to get your result, and you normally get the result through the post. If you haven't heard and you're concerned it's taking a while, then do get in touch so we can look into it for you. But don't worry if it does seem to be taking a while. It doesn't mean there's anything wrong with the result.
Is the test looking for cervical cancer?
Well, the smear test looks for what we call precancerous changes, which are early cell changes that could go on to become cervical cancer. If during the smear test the doctor or nurse sees something abnormal or worrying on your cervix, then they'll send you straight to the hospital.
Okay, and will it test me for other types of cancer as well?
No, the smear test doesn't look for other types of cancer, and it doesn't protect against other types of cancer. It also doesn't look for any sexually transmitted infections, so if you're worried about that, you must make an appointment.
Thank you for watching our video about cervical screening. Remember, if you have a cervix, then cervical screening is for you. It helps to save lives. Please contact your GP or practice nurse for further details. Thank you.